All right, hello everyone. My name is Brittany Martin, and today I'm going to be presenting my PowerPoint on my articulation disorders course research project. My topic is speech sound disorders in selected populations, and that population will be hearing impairment. So we're going to talk about speech sound disorders. During this development of a child's language, it's normal for children to begin to mispronounce words, mispronounce sounds. That is a typical developmental issue that we notice. But it doesn't necessarily mean that the child has a disorder or it will develop a delay due to that. Many children experience something called speech sound disorders, which makes it very difficult for that child to pronounce certain words regarding their expected age. So, just to be a little more particular, speech sound disorders involve the child lacking certain speech sounds, and sometimes they are unable to produce or use those sounds correctly. Speech sounds disorders can definitely be divided into two different types of disorders, which would be articulation disorders and then also phonological disorders. Alrighty, so we're going to break down a little more into articulation and phonological disorders. When we're talking about articulation disorders, this involves the inability to make certain sounds. It tends to focus on certain errors such as distortions and substitutions. And then it also is related to the motor aspect of speech sound disorders. On the other end, phonological disorders focus on predictable rule-based errors, meaning things like fronting, stopping, and final consonant deletions. This affects more than just one sound. The child may have difficulty understanding the language sound system, since we're talking about rule-based errors. And then it also relates to the linguistic aspect of speech sound disorders. And if you look in the right corner of the slide, I have a picture example of the different areas of speech sound disorders. And if you look, articulation and phonological disorders falls under the functional area, meaning that there are no known causes. So we're going to switch over a little bit to hearing impairments. This is a condition that can affect speech perception and production to varying degrees depending on the age and onset, the age of the onset and the severity of the disorder. Hearing loss is also described by the degree of hearing loss, the type of dysfunction, the age of onset, numerous things. And children with hearing impairments are typically at a greater risk for developing a speech sound disorder. So we're going to talk more about the articulatory and phonological characteristics of a speech sound disorder with a child who has a hearing impairment. Some of those characteristics that you will observe will be things like consonant deletions, consonant substitutions. Vowels tend to be neutralized. The child may experience a reduced overall speech intelligibility, particularly as linguistic complexity increases, meaning the child is unable to understand or comprehend speech the more that their language develops and their complexity of it increases. They may experience reduced speech rate, slow articulatory transitions with frequent pauses, poor coordination of breathing with syntactic phrasing, the use of duration to create stress patterns, and then also distorted resonance. So the emergent trends and then also hearing aids is what we'll talk about next. When we talk about a hearing aid, this is a battery-powered device that is designed to improve hearing by making sound audible to hearing impaired individuals. These devices consist of certain components that are the microphone, the amplifier, and then also the receiver. There are about 7 styles of hearing aids, and I'll list a few of them. They are your body aids, which is kind of an older method. We kind of use more of a miniaturization uh, type of device now, which would be things like your BTEs, which is considered behind the ear, your RITES, which is the acronym for receiver in the ear, your ITEs, which is in the ear, ITC, which is in the canal, CIC, which is completely in the canal, and then those implantable devices, which would be things like your cochlear implants. And speaking of cochlear implants, this is an emerging trend that kind of helped advance technology for speech sound disorders of the hearing impaired. Cochlear implants, they are a small, complex electronic device that can help to provide a sense of sound to a person who is either very hard of hearing, like severely, or has a profound deafness. This device consists of a microphone, a speech processor, a transmitter and receiver, and then also an electrode array. If you can look to the right side of this slide, you will see that I have a picture example of an ear with a cochlear implant showing you where the transmitter, the microphone, your speech processor, receiver, all of those things are located and kind of how it looks versus the external components and the internal components. Cochlear implants work by bypassing damaged portions of the ear, and they directly stimulate the auditory nerve. Then the signals generated by the implant are sent by way of the auditory nerve to the brain, and that helps recognize signals as sound. Originally, the FDA approved these type of implants for only adults with hearing loss. This was roughly about the 1970s to the 1990s period. And it wasn't until about maybe a 20-year change, which is about the 2000s, children aged 12 months and older that were diagnosed with severe hard of hearing and deafness became eligible to have these implants. So now we're going to go to the clinical and educational applications of speech and sound disorders with hearing impaired children. The speech language pathologist diagnostician needs to gather information and data before reaching a diagnostic conclusion. So some of that information and data that the SLP needs to collect would include the cause, the age of onset, and we're talking about the hearing impairments. So the cause of the hearing impairments, the age of the onset, the identification of the impairment, any etiology or the time of the implemented hearing device, the length of the prior intervention efforts, if any, speech intelligibility, results of testing for language skills, which the child will be tested for these things, so you'll gather those results. You would also want to get the client's as well as the caregiver's attitude towards their particular disorder. And then also, what is their need for intervention? Alrighty, so now we're going to talk about the phonological and phonetic assessments. These must be completed for a child with a hearing impairment. And there's like outlined procedures to follow when you are trying to assess these areas. So one of those would be your speech motor assessment. And this is used to rule out any gross neurological or anatomical limitations that might interfere with speech sound production. You also will need to focus on syllable imitation, and this tests the coordination of the speech mechanism during non-meaningful speech. The administration of the phonetic level evaluation, which is also the PLE, is an instrument used to evaluate suprasegmental and segmental skills. It provides a systematic, comprehensive hierarchy for the assessment of syllables with varied phonetic context. Yes. So then the next one will be spontaneous speech sample. And this involves maybe your SLP sitting down with the child and just having a conversational speech. They're just hanging out, they're talking, and depending on the age and development level of a child, this could be either using single words or a continuous speech. But ideally, you might want to get both continuous and single word speech. And then finally, the last one of the outline would consider the analysis of the segmental and suprasegmental characteristics of the spontaneous speech sample. Alrighty, so moving on. So we're still on the clinical educational applications, and we're going to focus more on the therapeutic part of this. Let me move this down. All right, so this goes on to saying the task for an SOP when providing services to a hearing impaired child is improving the child's speech intelligibility. When we talk about speech intelligibility, this deals with how clearly a person speaks so that his or her speech is comprehensible to the listener. So when we do this, we can create a structured work on speech sound errors and selection of a suitable phonetic treatment program. And there are two prerequisites that go into play with that. The first one will be the improvement of residual hearing, which would involve speech signal amplification, as well as the cochlear implant. And then also maximal use of residual hearing for speech production through systematic articulatory training. So when we talk about that first prerequisite, which involves improvement of the residual hearing through the amplification or through your cochlear implant, this involves a child wearing a hearing aid and at all times, but they also may utilize auditory trainers during their therapy. And when we talk about the second one, which is the maximal use of residual hearing through the systematic articulatory training, it involves children with hearing impairments. They tend to miss important information for recognition of speech signals, and this is typically the main reason for intelligibility. Okay, however, though, with children with these hearing impairments also need systematic training on the phonetic and phonological aspects, and how we involve that would be establishing a suprasegmental base. You also will teach the segmental speech sounds. Also generalize a stable production by using different phonetic contexts, and then also new syllables. They may also teach the segmental speech sounds. Oh, I'm sorry, I just said that. I apologize. Alrighty, and so then one more method that we would do would be the use of auditory verbal therapy. It is a method of working with a child who is hearing impaired or has some sort of level of deafness. You also work along with the child's family, and you create a system where they are able to develop spoken communication. And they utilize this as the child's primary form of communication or their primary method of education, no matter the level of the child's hearing impairment. Typically, someone who is going to implement auditory verbal therapy, it would be a qualified teacher who is a teacher of deaf and hearing impaired children, but also someone like an SLP or an audiologist. They have to be qualified in both aspects. And they have to also be certified through the Academy of Alexander Graham Bell, which is the Academy for Listening and Spoken Languages. Alrighty, and then on this page is going to include my references of where I got all of my information from. And if there is any further education that you would like to look up via this topic, feel free to visit all of these websites that are included under the reference page, but also pages like or websites like asha.org has a really, really good article and good information regarding speech sound disorders in this particular selected population. So that is the conclusion of my topic. Thank you so much.